the first in line because I wanted to get here early, get in the morning, get out. I need to have this front tooth replaced. I have a couple of fillings on the bottom. It's nerve pain, like the nerves are exposed. It's excruciating.
I've got a tooth up front that really needs something done to it in a real way, and I'd like for it to look attractive. And then I've got some other work that I need done as well, fillings and extractions, and I just simply don't have the money to do it.
I'm in pain with these teeth right here on the front because the fillings have fallen out.
I have 3 teeth that needs to be pulled mainly. They hurt a lot, but I have 8 teeth is all I have. So I'm gonna ask them to pull every one of them.
But I'm in pain, a bad pain. I'm grouchy at the end, and it affects my whole world. I have to stay in bed a lot because if it's really bad, and here lately it's been really, really bad. Now y'all coming at the right time. I mean, thank God.
Well, I've been on the board of Delta Dental Insurance Company for over 20 years. And knowing that they've been to Little Rock and to Northwest and to South, I kept asking them, we need to come to Jonesboro. And so through Delta Dental and working with ADA, the Arkansas Dental Association, they programmed it, but the problem for years is trying to get this facility. So we were able to work with the chancellor and the president of the university to get this facility on this date. And so everything just worked out great.
I understood last night they were already lining up before dark last night to be first in line so that they would get service. And in this day and age, we think about medical care and health care and dental care being so readily available, and yet we have a lot of people that literally cannot afford that. And so this is wonderful that we're being able to have this event here today.
It's great. I mean, it just blows you away that we're able to get a group together to do this for all the people in Arkansas that need it.
And so to see this in Northeast Arkansas, one, I think it shows that there's support in Northeast Arkansas for this. There's a need in Northeast Arkansas for this, and also there's a willingness to help the people in this area.
I've had 11 access teeth on one of them out.
Yeah, I don't see how you live. You got a lot of infection here, man. We took out 8 infected teeth today. He had 8 infected teeth taken out yesterday, so I think we've made some inroads to get him healthy. James, you did a good job, buddy. Take care.
You doing all right? We're just trying to loosen them up here just a little bit. We got tooth number 10 pulled out on Mr. Thomas. He's been married for 60 years, so we got to have him looking good for that wife, right?
You're doing good. You're doing great. We'll see. See how much this thing wants to get out of there. We just got through taking out a wisdom tooth on her on the lower left-hand side. She's got a little bit of healing to do, but she's going to be feeling a whole lot better now.
Okay, now right where I am. Yeah.
We have taken out 4 teeth on her, and then she's going to go get a new set of partials for her front teeth.
We're going to do some white fillings on her lower front teeth, composites, 3 of them.
Robert had 2 composite fillings done in the anterior teeth. He was an excellent patient. He's from Searcy and he came a long way and he did very, very well.
And she's an excellent dentist.
Thank you.
I've enjoyed the experience.
Thank you.
We need to clean his teeth too. Yeah, slow speed with that small round burr. We're going to dust it out. I know.
Do you need more? Did we get it all?
Good job.
Good job.
Well, I think this is a big success story on how you can do things right. You know, when there's so many things that people are complaining about being wrong, this is one thing we can point to and say these folks did that right. Arkansas State Dental Association, various government entities, you know, the City of Jonesboro, Arkansas State University, the private funding that made it possible.
Well, the Delta Dental Foundation from day one has looked for an avenue to give back to not only Little Rock but the whole state. And the Mission of Mercy program just fit in beautiful with our foundation goals.
This has been phenomenal. We have more dentists here than we've ever had. We have a great convocation center, so we have a lot of space. The City of Jonesboro has helped us tremendously, and so it's so nice that we have this many dentists to be able to get this many people. I think this year will be our record year.
Hey, if I can lift your attention to all the docs here on the floor and around everything. We have an announcement. You know, some of us have more gray hair than others. Some of us have a lot less hair than others. But we all have a common bond that we have spent together trying to help each other in the profession and help a lot of patients. And beginning Monday, Pocahontas is going to have one less dentist in its place, and Dr. Joe Jones is retiring, and he is right over here still serving our mom. Let's give him a hand. 45 years.
He is inspirational. When they had made that announcement, I said, he's my hero. That's what I want to be.
Just shows you the heart that the Dental Association has, all the dentists and all the people that are assisting them today. To give of their time and effort really is a true reflection upon the type of individuals that we have here in Arkansas.
This is my third year to do Director of Pharmacy. This is a well-oiled machine. It's a great team effort. And what I like about this is everybody knows their part. And everybody does their part.
I like how it feels.
We used to have volunteer lines out the door, but now we get them in and out of here and get them to the clinic floor faster. They get to work faster. They're seeing more patients.
I like how it feels.
The work that we're called to do in the mission field, in this case the Arkansas mission field, is the most rewarding work that I do as a professional.
I like how it feels. Ooh, yeah, I like how it feels.
This year, nothing went wrong. It was phenomenal as far as the skill of the general dentists that were doing dental extraction. So I would just cruise around and helped where I was needed and patted people on the back and had a real good time. So it was a phenomenal experience for me.
You know I like how it feels. Oh yeah, I like how it feels.
I'm from Magnolia, diagonally across the state, 5-hour drive. Had to come. I've made every one. In fact, I've made every shift of every RMOM. I'm not going to stop now just because it's a little further away.
Because I think we have to give back to our community, and that they organize this event to touch as many people as they can within our state and then some surrounding states. And it's just the right thing to do.
It's just, I mean, it's touched my heart. It really has.
I mean, just the patience.
I like how it feels. I like how it feels.
Feeling I'm going to get at like 4 o'clock when everybody's breaking down, and that's what I came for. You just remember them. It just comes into one big memory of makes you feel good.
Ooh, yeah, I like how it feels.
It's a blessing. Like, I mean, it's just, you feel so good about yourself and you feel like you just really helped people. And I love it.
You know I like how it feels.
Well, the patience is what makes me come back. I mean, it's beyond rewarding. It's hard sometimes to get away when you've got a family and kids, but once you're here and you see the work that the patients need and you feel like you're able to give back, it's the most rewarding experience, one of the most rewarding things I've ever done.
Ooh, yeah, I like how it feels.
I will tell you that we have had more people that have come in crying and hurting at any venue we've ever been to and walked out with a smile on their face. It just brings it here. Brings it here.
'Cause I like how it feels.
I had no idea that the level of services that were being provided. I thought maybe it was just a sort of a checkup or a cleaning or maybe some advice about what to do, but they're performing surgeries. There's a pediatric surgical unit. It's really like a hospital. I mean, it's like a 2-day hospital for people with problems with their teeth. And I just did not know that level of service was being provided before I came today.
One of the most important part of this Mission of Mercy that I am very happy to be a part of is, for the first time in our Mission of Mercy, we are doing dentures, partials, and flipper.
I did a presentation to the board of America's Dentist Care Foundation last August. Edie Airy from Delta Dental of Arkansas is on the board, and came to see the presentation. And it was through the introduction to her that she came to me and said, we'd like to do this in Arkansas. In discussing it with Edie over many months of preparation, we were able to set up the program so that we would come here, train dentists to do the procedure, introduce the Dental Association and the Missions of Mercy in Arkansas to the procedure, and allow it to be done ongoing.
I got all my top teeth pulled. I got my impression. I'm getting my dentures today.
I'm getting a new top plate made and my lowers relined.
Well, I ain't had any bottoms for a year or two, and it's been very hard for me to eat without any bottom dentures.
They fixed my denture here. It was broken and they fixed it, and they're making me a whole new top.
Yeah, it's pretty tough. Not being able to eat much.
We've already completed about 15 sets of dentures, so that's within 4 or 5 hours. Super cool. It's a great way to get the new dentist plugged in.
To me, it doesn't feel like we're going to have enough space.
I think probably the freedom area's got to be adjusted some more. Kind of push your tongue over the right side, good. Push it over the left side, good. Okay, just relax.
It's not only immediate gratification for the patient, it's also immediate gratification for the practitioner, because we can walk in there and change somebody's smile and change somebody's life, have them with a functional dentition within just a few hours.
I am really pumped up. This is what keeps us going. These guys like Herman.
It makes me feel better about myself, knowing that I'll be able to smile again, don't have to worry about hurting no more. It makes me feel good.
I'm going to go get me a steak, because today is me and my wife's 49th anniversary.
I don't want to smile right now. I'll smile tomorrow. I think it's great. I think this is a good thing that they're doing for the people. I really do.
I'm really happy with them. Y'all don't know how much I appreciate this.
My wife lost most of her teeth in a motorcycle accident 3 or 4 years ago, and it's been really hard on her because she kind of scares the grandchildren. But what y'all done is going to be such a blessing because they won't be afraid anymore. I don't know. I don't know how to thank this group, these people, these good volunteers so much, and the blessing it's caused. It'll create in our lives.
You ready for this? No, you're not ready?
This is gonna be the good life.
smile. Smile at the camera.
It's the best thing that's happened to me in a long time.
I've always said a dream doesn't have a color, it doesn't have a gender, it doesn't have a race, it doesn't have a taste. It's just what's in your heart to make that come true.